The reality of reopening has kicked in.
We have 22 confirmed new cases of COVID in Queensland, 3 Omicron cases.
Come tomorrow, the Sunshine State's unvaxxed will be banned from pubs, clubs and cafes as the state learns to live with COVID.
Now is the time to carry your mask and to start wearing that mask. This virus is rapidly escalating. It is spreading far quicker than Delta, and we're seeing that from interstate numbers as well.
But Victoria's going the other way. More freedoms for the unvaccinated, despite recording its highest daily numbers since late October.
There's been further easings of restrictions, but in some things like face masks, that needs to continue for a little while longer.
New South Wales has hit a record 1,742 new infections. After removing mask rules in most settings yesterday, today the state government shifted the responsibility.
Many businesses will simply say, for you to come in, you must wear a mask. And I 100% endorse that. And I would ask the community to respect that.
Now, with almost 90% of the Australian population over 16 double-dosed, everyone's talking...
The boosters. Boosters are certainly one of the keys to being able to fight back against this virus.
More than 860,000 Australians have had a boost, with around 4.1 million eligible by the end of the month. Pressure's mounting to speed it up.
Evidence in the last 48 hours that AstraZeneca is not particularly good at stopping Omicron. We need to hurry up our boosting of all the 60-plus-year-olds and those people who had AstraZeneca.
But there's already concern the booster program is falling way behind.
It's not the number of vaccines and it's not the ability to have the vaccines. The problem is the mass vax clinics, which are state-run, are trying to roll back because they're trying to get their staff back to the front line. And also there's been an effective reduction in support for GPs to provide booster shots.
Pharmacies are feeling the pinch too.
We are limited in resources. We are quite busy at the moment, but also the remuneration for vaccinations is half of what the GPs get.
So is enough being done to keep our well-deserved holidays intact?
Dr. Norman Swan, host of ABC's CORONACAST, joins us now. Norman, some experts are calling for boosters to be brought forward from 5 to 3 months. What kind of difference could that make?
It could make a big difference. Remember, we pleaded with Australians to get AstraZeneca vaccine, and Australians did, particularly Victorians, came forward in large numbers to get Astra. And the British data show that Astra, after about 14 or 15 weeks, has zero protection against symptomatic disease. It's probably still got some protection against hospitalisation, but zero protection against symptomatic disease. That's why the British went for 3 months, and it's why we should be going for 3 months too.
Yeah, I mean, Dr. Swan, I'm one of those people who did get AstraZeneca somewhat begrudgingly. Hearing you say that, I must say, does not fill me with a lot of confidence. There would be a lot of people like me in the community. What advice do you have for people that might be a little bit worried that they have no protection at all?
Well, no protection at all against symptomatic disease after 15 weeks, but almost certainly there is some protection. It's not complete immunisation, so there's still some protection against hospitalisation. We just don't know quite how much. There's more as if you've got Pfizer, there's more if you're younger. So what you've got to do is, as soon as you're eligible, is get a booster, whatever's available, Pfizer or Moderna. And in the meantime, I'd be wearing masks and just taking a bit of care.
Dr. Swan, good to see you. The PM says supply isn't an issue, yet we're hearing pharmacists and GPs are running out of supplies. What's going on?
Yeah, that's what you hear anecdotally. Well, I think it's yet another problem with the vaccine rollout. They've been lackadaisical, to be honest, about the booster program even before Omicron came along. This is not a let me just be clear. This is not a booster. This is the 3rd dose of the vaccine we were always meant to have. These are 3-dose vaccines. It's just that they didn't have time to actually get to that point and be sure about that in the first year of the pandemic. But there are other 3-dose vaccines around, hepatitis B, human papillomavirus, triple antigen in kids. 3-dose vaccines are not uncommon. This is a 3-dose vaccine. So even with Delta, to get fully immunised, you needed 3 doses. And we've been sort of taking it or leaving it. It's available, isn't that nice for 18 and over? When even with Delta, we needed actually to get on our bikes and increase this. And now we're compounding this by putting it onto the individual, and we're saying, it's now individual responsibility, when in any pandemic, the public health response is really important for the population as a whole. You cannot put this on individuals.
Doctor, there's been a lot of different advice when it comes to people who have had COVID, including myself, Captain COVID, and when they should get their booster. When is the right time?
Well, the good news for people who've had the infection, this comes from South Africa, is that they've looked at this and they found that people who'd had the infection, it's the equivalent of having a third dose of the vaccine. So, Pete, you might be okay, at least for the time being. It's hard to know when you should get your booster, but probably, I can't remember, did you get it before your vaccine or after?
After. So
After.
I was double vaxxed when I got COVID.
Yeah, so you've had effectively a third dose, and there's probably not a breakneck rush, but you're not going to come to any harm if you have a fourth one, just to be sure.
Okay.
All right, Dr. Norman Swan, we always appreciate your insights.
Well,
Thanks for your time.
I'll make sure my medical defence is up there, just in case something was happening.
I hope your insurance is current. Thanks for your time.